Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright, Philip, tell me what's going on with your shoulder, what happened?
Well, I have this kind of like frozen shoulder condition. Yeah, cannot
Lift
go
it up.
really far, to the side, to the back and behind.
How long this been going on?
For about 5 months, I would say. Yeah, last
5 months.
Mm-hmm.
Did you have any injury or falls or accidents or just had it random?
No,
Okay.
nothing. Yeah. It just happened one morning.
Yeah, you just woke up with the frozen shoulder.
Well, it was not like
Or
immediately,
gradually?
but it developed pretty quick. I would say within a couple of weeks, probably. Yeah.
So for the last 5 months, what kind of treatment did you have for your shoulder?
I did manual kind of like
Physical therapy?
therapy. Yeah, they trying to release muscle tightness around.
Yeah, and so you did exercises too. And
Yeah, did some stretching exercises. Yeah, trying.
So I want to see the range of motion that aggravated, and tell me from 0 to 10 how much pain.
Okay.
So let's do this. Can you do this?
Oh.
Yeah, it's very tight in here. You can lift this up. Okay.
Mm-hmm.
So let's do this. Bring it back and turn around. We'll have you stand up and facing me.
Okay.
This way. So you can see the difference. This is going up. This is just stuck in here. Okay.
Mm-hmm.
So thumb up and bring it all the way up. Face the camera. Okay. So I'm gonna measure your shoulders actually. But thumb up here and bring it up. Okay. So that's almost like 90 degrees here.
Yeah.
Okay. So how much pain did you feel with that? From 0 to 10?
6, 7.
6, 7.
When I hit this point. Yeah.
So which motion was like the most painful motion?
To me, I mean, I suffer from this one. Yeah.
Yeah.
Probably mostly because I don't do that.
You don't lift it up.
Yeah,
much.
because that's enough for me,
Yeah.
to do things like that. But when I try to put my clothes on,
You feel more pain.
I mean, when I try to do that kind of
Yeah.
motion from here,
Yes, it's probably the shower when you like shower. That's where you have the issue. Back and
Yeah.
forth. You left or right-handed?
I'm right-handed.
Right hand. So we'll have you line your back head here. Okay. So shoulder flexion. Bring it up as far as you can, pain free. Okay. So sorry. Okay. So shoulder flexion is 132. Oh, sorry. There you go. It's 132. Shoulder abduction. So this is like 85 here underneath. Okay.
Rotation.
Rotation, external rotation.
That's the worst.
Yeah, so external rotation will get this view. That's as far as you can go. So you see external.
It might be.
So he's like 15 degrees external rotation here. Okay. Internal rotation, so you know. Okay. So that's about 37. Okay. So you're really most of your limitation abduction. Okay. Everything pain free. Are you comfortable to take your shirt off?
Yeah.
Okay. Most of your pain is in the front, yeah?
I feel it, somewhere around here.
Okay.
But if I start, kind of trying to go with my fingers, I can find some fibers on the side of the shoulder.
Scar tissue? You think that's a scar tissue?
Yeah. I have a lot of those.
You have a lot? In here or everywhere?
I don't know. On the shoulder, especially.
Make sure this is not painful, okay?
Okay.
So how long you had physical therapy for? How long?
Working on that particular issue, starting from probably like 4 or 5 months.
For 4 or 5 months? Wow, that's a long time.
Yeah, and the only difference I can feel
Mm-hmm.
is that, as I said, I don't have those like excruciating pains shooting through the whole hand.
But your range of motion is still the same.
Pretty much.
Yeah, sorry about that.
Yeah. Sometimes it kind of works right after the session. I kind of have this thing restored, but then it kind of goes back.
Mm-hmm.
Yeah,
Mm-hmm. Have a lot of scar tissue, but I will show you the scar tissue actually. You're gonna feel cold, okay?
mm.
You hear that?
Mm-hmm.
That's a scar tissue.
Why is it there?
Scar tissue.
Why is it there? What could it be?
You usually get the scar tissue from accident, trauma, poor posture, poor body mechanic. If we don't have a history of injury, it usually happens over time from bad mechanics, like bad posture, sleeping, slouching forward, or or like sleep posture.
Gotcha.
But if we don't know like what the triggers, it's
Mhm.
usually bad ergonomics for a long time. You feel this bump here?
Mm-hmm.
That's our scar tissue. And here, feel that?
Yeah.
And you will see, after I finish, there's more redness where the location of the scar tissue compared to everything else with the normal skin to color. So, look here how much scar tissue you have. You see the redness?
Mm-hmm.
It's not everywhere, but you see here. And this is the washboard part, your favorite one. I'm gonna work on the back. Perfect, yeah. Mm-hmm. And no, that's too much, okay?
Yeah.
Too much?
You're hitting when it starts feeling
Sorry,
tender.
sorry.
It's not kind of that painful, but
Is it okay or is?
Yeah, it's okay. It's okay. Yeah, I'm just saying that. Yeah, it started.
Mm-hmm. You feel this one here?
Mm-hmm.
That's a big knot here in this area. Alright, so we're gonna give you some water and we'll have you do the range of motion.
Mm-hmm.
Yeah. So let's do the motion that aggravated. So how's that? Look at this. You see that?
Yeah, I can
that's
see.
nice. Beautiful. That's better. Let's thumb up, and that was like 85 degrees. Let's bring it up. Look at this. You're over 100 now, 120, 20 something.
I can feel like
Yeah.
there's something happening there.
Can you tell the difference?
This one, not that much, actually. Yeah.
My expectation, the flexion and abduction gonna come first before this. This is the last one.
Mm-hmm.
So
What's next?
we're gonna get this like as far as you can. Look at that. It's not bad. Let's do the side again. And tell me, where do you feel the tightness? Where? All in the back with those motions?
This one?
And
On the
this
kind
one?
of side.
Okay.
Yeah, it's kind of
And the front?
on the front. Yeah, probably the same area, kind of.
Okay.
Like, it's kind of like capturing something.
So let's actually lie in your back head here,
Mm-hmm.
because we're able to bring this back and work in here.
Oh.
Is that painful? It's okay.
No, it's just that area
Ticklish?
which the guys worked on the
The,
subscap and the lats and
the physical therapist?
yeah.
What did he used his hand?
Yeah, they tried to how do you call that technique? We're trying to
Break this massage?
it's not massage, it's like
Joint mobilization?
kind of trying to apply the pressure on the muscles, the trigger points, to
Yeah.
cause the release of the tightness.
I'm not sure about that. Yeah. Trigger point release with their fingers or elbow.
Well, yeah, kind of finger or elbow
Yeah.
or any kind of
That's,
pointy.
that's painful.
It is.
Sorry. Let's actually sit up again. We'll have you drink a little bit more water and do.
Adduction.
Mhm. How's that? Look at that. Are you trying to show off now? Okay. So you had 4 months of physical therapy before coming here, or 5 months?
Right.
Up. Okay. Where do you feel it when you do that?
It seems like something happening here.
And what's up?
Yeah.
Did you feel a difference after work to here on the bottom here? In this area?
In that particular motion,
Mm.
I would say no.
More in the, okay, that's much better. Okay, so let me work on inflammation now actually, because I worked on the proliferation. Let's lie in your back. So I worked on the scar tissue, the fascia restriction, all the tightness, but because you did not have the full range of motion, I have a special magnet I designed. It's called Magna Heel. So I'm gonna use 2 because when I use the 2, it's actually the range in between 4 to 5 inches. So to really get deep in the joint to decrease the inflammation. So if it's a mild inflammation, we should get you more range of motion now after using the Magna Heel for a few minutes. So we're gonna know how bad is your inflammation in your shoulder. But you were not able to do this for 5 months.
Yeah.
Yeah.
Oh,
Mm-hmm. Let's sit up and try it again now. We'll have you, let's drink some water. So we'll do the flexion. Where do you feel the tightness?
I don't feel like a sharp pain anywhere, I would say.
But
I
where do you feel this
feel
tight?
like it seems like something is holding, maybe, when I'm trying to go further.
Mm-hmm. Okay.
Like
where-
something
in
probably
here.
kind of trying to hold it and
Right
not
in
kind of like.
here? Okay. Let's do the abduction and tell me where do you feel it's limited.
I go somewhere around here.
Mm-hmm.
Can
Right in the back here.
yeah, and this
not-
one is tender when you.
Okay.
So.
Okay. You're comfortable lying on your stomach?
Yeah.
Okay. So we'll have you lie on your stomach. What's going on with your back?
It, well, I would say nothing at the moment, but yeah, the kind of chronic condition when I wake up in the morning, it's
Step.
it's a little bit like I'm like kind of trying to, you know, and yeah, I have also the thing when I what would I say, when I'm kind of sitting. Oh gosh.
Is that painful when I'm doing this? Okay.
No, it's okay. It's okay.
Mm-hmm.
Yeah, I'm just trying to kind of
Mm-hmm.
find the right words.
Mm-hmm.
So yeah, if I'm doing, for example, something on the floor, like I don't know, hitting the nail, trying to hammer the nail, and I'm sitting for a long time, and then when I try to stand up and stand still, I cannot like actually.
Stretch your back.
Yeah, it's kind of like I'm.
Step.
Yeah, I'm stepping, so it takes me time to actually.
To sit up.
You know,
Okay, it's gonna feel cold again, okay?
mhm.
Sorry. Drink some water and tell me how it feels. Okay?
Okay.
So we're gonna do the range of motion again, the flexion, abduction, external rotation. Let's see how you feel with it. How's that?
Stopping right here.
Mm-hmm. And let's do the abduction. That's better.
Yeah, a bit better, I think.
Mm-hmm.
Now
So
kinda-
this motion.
There is a feeling right
On
here.
that spot?
Yeah,
Okay.
going through the
Mm-hmm.
biceps. So next one is.
That's a lot better. This one.
Yeah, I think.
The back one. Oh wow! Look at that.
Yeah, it went
It
further.
went up. Oh,
Mhm.
okay. So do me a favor. I will have you sit again here. Yeah, you are classic frozen shoulder.
I am.
Yeah, and that's not bad. The range of motion you get in just a few minutes working on it. So we'll do the flexion forward. How's that? You're almost getting there.
Yeah, I feel something right here,
Yeah, okay.
a bit, and probably something holding kind of here.
Abduction. Look at this. Wow.
At the end, yeah, kind of
And that's
something
it. Okay.
right here.
What about doing this? That's nice. Mm-hmm. Backward. That's nice. Okay, that's not bad. So let's have you sit here, and we're gonna go over there. You feel it here? You said.
Yeah, I think
And here.
something was here, yeah. And, but the on the side,
Mm-hmm.
I'm not quite sure. It's not quite, kind of focused. It's just,
All over. Yeah.
yeah. I think it's kind of maybe because
Mm-hmm.
the muscle is too
Mm-hmm.
large.
Well,
and you
sometimes it actually takes 24 hours after this
cannot-
that you're gonna feel better, and you get more range of motion. So
Mhm.
sometimes it takes the body time to get adjust to all this manual work. you know.
Well, yeah. I mean, I'm surprised that it reacts even from that almost immediately to some of those procedures which
Yeah,
you do.
yeah.
So.
Yeah. Okay, let's drink more water and try it again.
Just
Now we're making it up now. How's that?
some kind of block here.
Mm-hmm. And
Yeah, block again,
Yeah.
something around
let's do
here.
this range of motion. Nice. And back. So 5 months of not able to do this range of motion.
Oh, yeah,
I'm very
that's-
happy with.
I'm
what you
also happy.
Well, I will take the range of motion again,
Mhm.
the measurement, and see what how
Okay.
much you get. So we're gonna review the numbers and we'll write the new numbers next to it. Okay? So flexion was 130.
32.
Sorry. Okay. So let's do the flexion again. All the way. Okay. Okay, so the flexion is 150. Abduction was 85. Okay, so abduction 85 was, now it's 140.
Yay!
External rotation
15.
15. This is the range of motion I expected gonna be the last, but we'll try it. Okay, bring it back. So this is 20. Internal rotation,
37.
how much?
37.
37, okay. Relax, relax.
Mhm.
Okay, so that is 50. 52. Okay, so we'll have you sit up. And we're gonna do the range of motion again and tell me how you feel. Flexion again. And we'll do the abduction. Do this range of motion. And the backward. Okay, how's that? Can you tell any difference? You had physical therapy for 4 or 5 months.
I mean,
Can you tell a difference between ASTR and what you had before?
Yeah. I can tell. It's
Yeah.
for sure.
Yeah,
Changes the picture quite
Mhm.
dramatically.
yeah, yeah.
Yeah. Let's see how it kind of
Mm-hmm. Yeah, awesome.
Will it behave tomorrow?
Yeah,
See.
we'll
And yeah, I'll try to, as you said, try to notice how it's gonna behave
Yep.
in between the sessions.
Awesome. Thank you.
Thank you.
All right, Philip. So tell me, today is your third visit
Right.
after treatment. So can you give me an update? How do you feel, and what do you think about the treatment for your frozen shoulder?
Well, I mean, I definitely have improvements on the
Mhm.
range of motion.
Mm-hmm.
I mean, some are still kind of like not perfect,
Mm-hmm.
but yeah, the flexion and abduction, it
Mhm.
was really,
Improvement.
yeah,
Mhm.
great improvement.
Mm-hmm.
So I think that thing kind of like works.
Yeah.
I guess I only wish I had a few more days, probably, or just to have a possibility to go in regularly
Yeah.
on those visits. So
Yeah. So you had the frozen shoulder for 5 months, is that correct?
yes, about 5 months.
About 5 months. And before coming and see me, how long did you see the physical therapist for?
For those 4 or 5 months.
For
yeah.
5 months. How many times a week?
Well, it's weekly, probably. Sometimes it's bi-weekly. Yeah, it depends
Yeah,
on the
so-
schedule.
So total, how many visits you had it with the physical therapy on average?
So you can calculate probably about 20.
20 visits. So you had 20 visits before for frozen shoulder, for
Mhm.
your shoulder, and can you tell the difference between those 20 visits and 3 visits of ASTR? What like stood out for you?
Well, the effectiveness, of course. Yeah,
Mhm.
I mean that's the probably the major factor that
Mhm.
yeah, after those 3 visits here, I have those my range of motion back. Yeah, on
Mhm.
some of them.
So we're gonna take the range of motion again. So originally when we started, the flexion was 130. Okay. So we're gonna bring it back. Okay. So that was 130, 132 before. Okay. So now is about 155. Okay.
Mhm.
So the abduction was 85. Okay, so let's do the abduction from the top. That was 85. So this one is, can you see this? It's 168. You see that? Okay, 168. Okay, so let's sit up. All right. So what would you say for prospective patient about ASTR treatment? You came from Texas, so what do you think? Like, or like?
Well, I
coming
would
to
definitely
California?
recommend this
Mhm.
this treatment
Mhm.
because yeah, it's pain free.
Mhm.
Yeah, compared to some of the techniques, yeah, when they're like those trigger points and then they press and they
Mhm.
feel painful. So yeah, definitely it's something everybody have to try
Yeah.
if they want to see the difference and improve their conditions.
Yeah.
So yeah, I'm
Awesome.
looking forward, yeah, to seeing even further results when I
Yeah.
work at home.
Yeah. Awesome. Thank you so much.
Thank you.
You need to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!